nursing officer by profession, and currently I'm the facility in charge Eagle Nursing Home. Eagle Nursing Home has got three branches. We have Kangemi, we have Eagle Nursing Home Kawangware, we have Eagle Nursing Home Kibera. In these three branches, we have the outpatient department, inpatient department, maternity department, dental department, X-ray, radiology department, as much as pharmacy department, laboratory department, and all these departments, they have representatives who make sure that you get the quality service as possible. In Kangemi, we have 3 consultations. In these 3 consultations, they enable us to flow clients as fast as possible. We have tried and reached the protocols of COVID-19. We have the sanitizer for our clients. We have hand washing practices when you're in the entrance of the facility. We have the social distance at 1.5 meters away from each and every patient. We serve in 3 consultations. We have the medical officers consultation and the clinical officers consultation, the 2 clinical officers consultations. This is whereby we do the primary diagnosis and any other diagnosis to our patients. This patient is directed to the laboratory. In the laboratory, we have adequate staff that ensure that there's a turnaround time which is faster as possible. In the laboratory, we do several tests. We are able even to do the big tests like the UECs, LFTs. We do the fluorograms. We are doing the malaria test, and we are upgraded to doing the TB test to our clients. This is whereby we believe in the results that are coming from our laboratory. In our laboratory, we are doing the controls. We are ensuring that each and every machine is working and giving the correct result to our patients. When we go to the consultation, this patient will be sent to a pharmacy. Our pharmacists are given the adequate and qualified staff as possible. We ensure that the person who is dispensing the drug is a qualified person, is registered. We ensure that we are giving the correct medication to the correct patients and the correct prescriptions, so that when this patient is given these drugs, there's a clear information that is given to this patient to ensure that this patient walks out of this facility as comfortable and feeling happy for the service. In Kangemi, within the surrounding, we are the leading in emergency services. When a person comes as an emergency, we give this person the first priority as possible. We are receiving most of the gynecology emergencies. We are receiving the road traffic emergencies. We are receiving the pediatric emergencies and any other emergencies that are occurring within the surrounding. We are good to serve this patient, and we ensure that this person on casualty receive the start doses before even taking the investigation, because with emergencies, the main thing is we stabilize. In our casualty, we have to identify, can we admit this patient or can we refer this patient? This patient is consulted by a medical officer and a physician. When the consultation are made, this patient is informed of what is healing this patient. The relatives, as much as they're concerned, they're informed about the status of their patient. When this patient is for admission, we ensure that cardexing is done correctly at the casualty. Treatment sheets are documented well in the casualty, and we ensure that this patient is escorted on a wheelchair or a stretcher to the comfort bed. On receiving this patient in the ward, we ensure that total nursing care will be given to this patient. When we talk of referral at an outpatient, when a patient comes and we see this is a critical case that we cannot handle, what do? We inform the relative that this patient will benefit from level 5 or level 6 facility. We inform them, and we have an active and alert ambulance that will take this patient to the facility that we have called and has accepted this patient for management. In charge, we do the BP measures. When someone comes with hypertension and it's very high, hypertension is whereby the blood pressures are very high, this person is given the first priorities and given the first doses as quick as possible so that this patient can see a doctor for further management. We do the weight monitoring in the triage. Then this patient is able to see the doctor. MCH is whereby we serve these mothers that are pregnant and the children who are coming for immunization. We give these mothers the first priority in that there's no queuing in our facility. We fasten the service by equipping the MCH with adequate staff who are qualified, and we have the nutritionist on the MCH to ensure that growth monitoring is conducted well. We ensure that these mothers are given correct information when they are waiting for delivery. We have one of the leading theatre around, whereby our theatre is doing both gynecology surgeries, we are doing the orthopedic surgeries, we are doing the general surgeries, as much as each and every surgery around. This theatre is kept with qualified theatre nurse, and we have the surgeons around that are on call, and they come and assist us where necessary. When we go to the surgical ward, this is whereby we ensure correct information is given to this patient, assistance of ambulation is taken place in the surgical ward, and management of surgical wounds are done professionally and with the trained personnel. When we go to our medical ward is whereby we give the correct medication to the correct person and by the correct personnel. We ensure that these patients are receiving the correct everything that they need. In inpatient services, we ensure that our rooms are warm, they are very clean. On IPC protocols, we are observing the IPC protocols. The nurses are given gadgets to take care of these patients. We have sanitizers in our wards, and there are some wards that have the sinks. The sinks are used to observe the IPC protocols. On matters pertaining waste disposal of the wards, we ensure that shelves are well kept, the dustbins are covered and are emptied frequently. The special clinics are the gynecological outpatient clinics, which usually happen on each and every Thursday. The pediatric outpatient clinics usually happens on each and every Tuesday. We have the diabetic and hypertension clinics. These clinics usually happens on each and every Friday. We have the nutrition clinics. Nutrition clinics happens each and every Friday. We have the CCC clinics. The CCC clinics is the comprehensive clinic care. This is whereby we give ARVs to our patients, and we have an HCS counselor who counsels this patient when they come, and the doctors who review these clients and do a refill to them. And generally, we have the medical outpatient clinic. The medical outpatient clinics are those adults that are discharged, that have been managed medically, and they are given a return date to come for checkup. These clinics happens each and every Tuesday Our ambulance is one of the leading ambulance and active ambulance around. The ambulance is 24 hours, as much as all facilities are 24 hours operation. This ambulance has a trained emergency medical technician and a very trained ambulance operator. They work hand in hand to ensure that this patient, when they are brought in our facility, at least something has been done. We don't just escort patients from one facility or from an accident or from an emergency area to the facility. We say our ambulance is a walking hospital because something has to be done for you to be evacuated and be taken to a health facility. As such as any other institution, when you are serving the underserved, you need to have humanity. The challenge comes whereby we are serving the slums mostly, and you find that these slums have illiterate people. Most of the road traffic accidents are brought by Good Samaritans. Good Samaritan, we end up not getting the full details, full history about this patient. It brings a gap in that we find it very difficult to get any relative from this client, and therefore we take it as a humanitarian heart in that we need to diagnose this client, treat this client. At the end of the day, we'll find someone who can speak in the same vernacular so that information can be captured. The second challenge we are experiencing Ego Nursing Home, you find that we are surrounded by those people who didn't go to school. Sorry to say that. But in accordance to how they handle emergencies, you find that someone has been hit by a car. They carry him like 10 or 20 individuals. They don't know that the facility has a lift. They end up using the stairs. You find that they are on halfway to bring this client up. So what you do, you just have to calm them down, handle the client in good condition, but others, they might see that because you are a doctor, you should start doing something on the stairs. But that's not the way we handle things. The patient has to reach to the casualty department. You find that we are admitting patients who are using cash pairs. This patient, due to pandemic, he has not been at work. This patient needs to be discharged, but there's no funds to cater for this patient. Then you find that there's another patient somewhere who's lacking the bed. What can you do as a human being? You cannot chase that patient. We go through consultations. We call a social worker. A social worker gets the full details and the investigation. Then we have to sit down as the management and see how we can waive this client to go home and continue with the daily responsibilities. We are level 4 facility, and in accordance to the NMS protocols, you cannot just refer this client direct to Kenyatta. And you see, on how we perform, we believe that we are even doing better than Mbagathi. And the Kenyatta tells us now you need to refer your client to Mbagathi so that Mbagathi can refer to Kenyatta. So it brings a challenge whereby it's better we do it direct to Kenyatta, because what we can handle, we believe that Mbagathi can handle. What Mbagathi can handle, we can handle. But it becomes a challenge whereby when this patient is taken to Mbagathi and Kenyatta are refusing this client, at the end of the day, the ambulance team has to bring back this client. Then we have to seek on how to save the life of this client. And that's what we do as Ego Nursing Home. We welcome you to Ego Nursing Home. Your good health is our solution.